everybody, it's Dr. Tracy Papa. Have you ever wondered why your OB doctor became an OB doctor and what it takes to become a doctor in general, how people choose their specialty? Today we're going to talk with one of our senior residents, Dr. Alex McBath, who was going to tell us exactly that, how he got interested in medicine and in OB in particular, and you get to get a peek into what it's like to be a doctor, especially a resident, what their lives are like, what their days are like. It's a fun episode, so enjoy.
My name is Alex McBath. I'm a third-year OB-GYN resident at John Peter Smith Hospital here in Fort Worth. I grew up in Houston, Texas. I did my undergrad at UT Austin, and then I went to medical school in El Paso, Texas, and then made my way out here to Fort Worth for residency. Our entire third year is subspecialty training. We do 4 different subspecialties, 3 months in each to take up the entire year. So we do reproductive endocrinology and infertility. We do gynecologic oncology, so any female cancers, urogynecology, things like prolapse or incontinence issues, and then maternal-fetal medicine, where we deal with the high-risk obstetrics. I guess a typical day in the life of an OB resident really depends on what you're doing that day, but typically we're at the hospital by 6 o'clock in the morning, so we can go and make rounds on all of our patients that are admitted to the hospital in preparation for whatever we're doing for the rest of the day. If, for instance, we're doing labor and delivery, then by 7 o'clock we're on labor and delivery, ready to go to get handoff from the team that was working, say, overnight. And then at that point, it's kind of just depends on what rolls in, you know. Every once in a while, you'll have your shift change deliveries, or you're getting set up for C-sections. Sometimes there's not a whole lot going on, and it's more labor than delivery. It really just depends. Typically, you know, if we're on labor and delivery, we'll finish work around 6 or 7 p.m., so 12 to 13 hours minimum in the hospital each day. Clinic really can go either way, so we always try to be done by 5 p.m., but sometimes we are running a little behind, but still long days regardless of where we are. So residency is probably for the most part what I expected. You know, in medical school you get to work very closely with a lot of the residents, so you kind of know what to expect as far as the lifestyle. You expect to be basically living at the hospital and have very little time outside of work for social life. I think what a lot of people don't expect or don't anticipate is the difficulty that there is with maintaining social relationships outside of the hospital. So of course we see our co-residents every day. We make very good friends with them because we're spending 80 plus hours a week with them at times. But you know, everyone has those significant others or family, parents, children, dogs, things, people who rely on them at home. And sometimes it's very difficult to make adequate time for those people at home. And that has been one of the biggest challenges for me in residency. Here at JPS, they, you know, definitely do encourage you to kind of stay on a set schedule and make sure that everyone kind of works together, make sure that we're getting home at a good time. We really work as a team to make sure that people who are trying to wrap things up, we can facilitate that for them. If we're taking over their shift, you know, ask if there's anything we can do to help you get home faster so that you can go home and be with your family. This group, of course, since we are a relatively small program, just 4 people per class, we're very close as a unit as well. So a lot of times outside of the hospital, we try to organize some social activities with the significant others or with any family members so that we can interact somewhere outside the hospital, which is very nice. So as far as trying to see what life is like after residency, I guess a big part of it, for me anyway, is deciding what would be best for my significant other, career-wise, because of course for anyone who's going into this specialty, they do have to, you know, take into account what their family is going to be doing wherever they end up. In OB-GYN, I'd say for the most part people end up in larger cities, so that at least makes it easier for the families because generally there's job opportunities available, as opposed to some specialties that lean more toward the rural areas, which, you know, you can't do every job out in the country. So I think geography plays a big factor for me. You know, deciding whether you want to work in an academic program, if you want to teach residents or teach medical students, if you want to be more on the private side and not have any teaching involved, if you want research involved, these are all things that factor into the decision of where you're going to practice. These are all things I'm still deciding, so I have not quite come to a conclusion on that, but I'm at the point where I need to start making some of those decisions. One of the main things that I was recruited to this program for by the chair of the department when I was interviewing was LGBT health. So this was actually a big part of my medical school training. We designed a curriculum in LGBT health that's now been integrated in the permanent curriculum at my medical school. So kind of one of the first things that I did when I got here was to put together a presentation for the residents that I gave on this topic. Also talked to the family medicine residents, gave grand rounds to the entire department about this topic. So this has continued to be a point of interest for me, particularly the transgender aspect of medicine. And as we're starting to see more and more trans patients in our clinics, kind of counseling them and making sure that, one, they're getting well-rounded health, because it can be very complicated and a lot of these patients don't have access to well-rounded health care. But two, also just the specifics of this population, and hormone therapy and preparing for surgery if that's indicated, and facilitating all that is quite a complicated process. As far as I know, there is not a dedicated specialty that is going toward transgender healthcare. There's kind of a broad range of specialties that contribute to it. Definitely so in the big centers like out in Boston, San Francisco, it's probably mostly spearheaded by family medicine or internists, specifically endocrinologists. Of course, general surgeons have their input, OB-GYN has their input. Psychiatry is a big factor as well, because of course any point of transition or any major surgery, any major changes in life can be quite difficult to deal with psychologically, and so making sure that people have someone to talk to and an outlet for counseling is very important. So really it's a multidisciplinary transition, and it would be nice if there was just a specialty dedicated to that, but as far as I know, not one has emerged. When I first started medical school, I actually thought I wanted to go into general surgery. I wanted to do something active with my hands. The more I kind of did more studies, I kind of leaned more toward family medicine because I wanted to do something very broad, just because I wanted to be doing something a little different every day. OB-GYN was actually my very last rotation of my third year, which is typically when most people decide what they want to do with the rest of their lives and start getting their applications ready. And I was literally just standing there one day doing a delivery, waiting for this baby to come out, and just kind of thought to myself, you know, I could do this for the rest of my life. And so that's when I changed, and here I am.
Alex is one of the nicest people I know, and I know he's going to be a great OBGYN physician. Don't forget to like this video and subscribe for more great content. Also, you can find me on my website, drtracypapa.com. If you'll fill in your email address, I'll send you more great content, including a great free guide to self-care during pregnancy. Stay tuned. See you next week.